There is a force that acts upon your body every single second of every single day. From the moment you are born until the moment you leave this earth.
It is the force of gravity. For a young person, gravity is a challenge to be overcome.
A force to jump against and run against. But for the aging spine, gravity is a compressor. It is a weight that slowly, relentlessly crushes the vertebrae together, squeezing the life out of the delicate shock absorbers that sit between your bones. We often wonder why.
We get shorter as we age. We wonder why we wake up with stiff backs that take hours to loosen.
We wonder why we develop sciatica numbness in the legs, or that deep, nagging ache
in the lower lumbar region. The answer is compression. Over decades, the soft gel-filled discs in your spine lose their water content.
They dry out, they flatten, and as they flatten, the space between your vertebrae shrinks.
The nerves that exit the spine, specifically the sciatic nerve, get pinched. The joints grind bone on bone.
The medical solution to this is often aggressive.
Doctors prescribe painkillers that erode the stomach,
or injections that degrade the tissue, eventually leading to the suggestion of spinal fusion surgery. A procedure that locks your spine in place forever. Removing your mobility in exchange for stability.
But what if there was a way to fight back against gravity without a scalpel?
What if there was a simple mechanical action that could reverse the compression? Creating a vacuum inside the spine that sucks life-giving fluid back into the discs. Relieving the pressure on the nerves and restoring the space that time has stolen.
This action is called spinal decompression, specifically a technique known as
The passive hang.
or hanging upside down by your ankles like a bat.
So, thinks. Let me be clear, that is not what we are talking about.
For a senior with potentially fragile shoulders or blood pressure issues.
Those extreme methods are dangerous. We are talking about a modified supported hang.
A gentle, calculated stretch that uses your own body weight.
And a common household fixture to create traction in the spine without risking your safety.
In this comprehensive guide, we are going to explore the biology of the hanging stretch.
We will explain the anatomy of the intervertebral disc and why it needs negative pressure to heal.
We will reveal the kitchen sink method, a technique used by physical therapists
to relieve stenosis and sciatica in patients who cannot tolerate aggressive exercise.
And stay with me until the end, because we will provide the daily decompression protocol.
The specific timing, breathing, and hydration strategy you must follow.
to ensure that the space you create in your spine stays open, allowing you to stand taller and walk without pain.
Before we dive in, if you have not subscribed yet, I recommend you hit that button and turn on the bell.
Part 1. The hydraulic shock absorber. To understand why this stretch works, you must first understand the engineering of your own back. Your spine is not a solid rod. It is a stack of 24 movable bones called vertebrae. Between each of these bones lies a technological marvel called the intervertebral disc.
Think of the disc like a jelly donut.
It has a tough outer layer called the annulus fibrosus, which is like a tire made of layers of collagen. Inside this tire is a soft gel-like center called the nucleus pulposus. This gel center is mostly water. It acts as a hydraulic shock absorber. When you walk, run, or jump, the water in the gel distributes the pressure, preventing the bones from crashing into each other. However, here is the design flaw. The discs do not have a direct blood supply. Most tissues in your body get oxygen and nutrients delivered by arteries. The disc does not. It is avascular.
So how does it stay alive? How does it get fresh water and nutrients to repair itself?
It relies on a process called imbibition. This is a pump mechanism.
When you move, specifically when you compress and release the spine.
The disc pumps waste products out and sucks fresh fluid in.
But the most important part of this cycle is the release.
During the day, gravity compresses the disc, squeezing the water out.
This is why you are actually about ½ an inch shorter when you go to bed than when you woke up. At night, when you lie down, the pressure is removed and the disc sucks water back in like a dry sponge.
But as we age, the outer wall of the disc becomes stiff and the gel inside becomes dry. The sponge loses its ability to soak up water.
Furthermore, if we have poor posture, or if we are overweight, the spine never truly decompresses.
The pressure remains high 24 hours a day.
The disc begins to starve. It dries out, it cracks, and it bulges. This bulge presses on the spinal nerves, causing the electric pain of sciatica.
To fix this, we cannot just drink water. We have to physically create space. Part 2. The vacuum effect.
We have to physically create space. We have to pull the bones apart to create a vacuum that draws the fluid back in.
This is where the concept of traction comes in. In a clinical setting, you might see a traction table,
where a machine pulls on your legs while strapping your chest down. The hanging stretch replicates this mechanism using gravity.
When you anchor your upper body and allow your lower bod to hang loose, and you create a negative pressure inside the disc.
Physics dictates that fluids move from areas of high pressure to areas of low pressure. By creating a vacuum, specifically a negative pressure of roughly -100 millimeters of mercury, instead of fluid being squeezed out, fluid is sucked in.
This influx of fluid brings with it oxygen, glucose.
But more importantly, the vacuum effect can actually pull a bulging disc back into the center
If the jelly has been squeezed out, relieving the pressure on the nerve. This is why decompression is so powerful for sciatica.
But for a senior, simply hanging from a bar is dangerous. Your shoulders may have arthritis.
Hanging with your feet off the ground can trigger a reflex where your back muscles tighten up to protect you.
We need a way to hang that allows the back muscles to relax completely.
Part 3, the kitchen sink hang.
The safest and most effective way allows you to control the amount of weight you offload.
Step 1. The grip. Stand facing your kitchen sink. Ensure the edge is dry and clean. Place your hands shoulder width apart.
Step 2. The walk back. Slowly walk your feet backward while keeping your hands firmly gripping the sink.
As you walk back, lower your hips. You want to end up in a position where your arms are straight and your torso is angled forward. Step 3, the drop. Now here is the critical move. Keep your feet planted, drop your hips backward and down as if you are trying to sit in a very low chair behind you.
As you drop your hips and keep your arms straight and hold onto the sink, you are using the sink to hold your upper body up.
Step 4. The suspension. You should feel a gentle traction or pulling sensation in your lower back.
Because your feet are on the floor, you are in control. If it hurts, you can stand up instantly.
You can shift your weight side to side gently to open up the tight spots in the lumbar spine.
Step 5. The breathing. You must breathe deeply into your belly.
When you exhale, visualize your tailbone dropping heavier towards the floor.
Hold this position for 20 to 30 seconds. Then slowly stand up by using your legs, not your back.
Part 4. Why this works for seniors. This specific variation is superior. First, the angle.
with the muscles of the back and the hamstrings, where stenosis usually occurs.
Second, the control. You can modulate the stretch. If your shoulders hurt and you do not have to drop as low.
Third, the relaxation. Because your feet are grounded and your brain does not panic.
Part 5, the door frame variation. If you do not have a sturdy sink, you can use a door frame.
With your hands anchored, slowly bend your knees and let your body weight sag straight down.
Let your head hang loose, particularly good for seniors with kyphosis and the rounding of the upper back.
Part 6, the psoas connection. There is a hidden muscle. It is the psoas muscle.
When you stand up, a tight psoas pulls your lower vertebrae forward, creating an excessive arch called hyperlordosis.
When you perform the kitchen sink hang, you are stretching the psoas.
Part 7. The stenosis relief acts as a mechanical reset for the narrowed canal.
Part 8, the hydration rule. You must drink a large glass of water before you perform the stretch.
Doing this stretch while dehydrated is like trying to squeeze juice out of a dried lemon.
Part 9, the contraindications. Condition 1, severe osteoporosis.
Condition 2, shoulder instability. Condition 3, glaucoma. Do not look down at the floor.
Part 10, the elbow variation. Place a towel on the countertop. Rest your elbows and forearms.
Walk your feet back and drop your hips. This transfers the weight through your elbows.
Part 11, the daily dose. It is a hygiene practice like brushing your teeth.
Time 1 morning. Time 2 before bed. This is the most critical time.
Time 3 after a walk. Decompressing immediately after exercise helps recover.
Part 12, the long-term remodeling. The inflow of nutrients allows the disc to heal micro tears. You stand taller. You are retraining your body to fight gravity effectively.
Gravity is the enemy, but gravity is also the cure. We flip the script.
It restores space. It restores fluid. And it restores the potential for movement. You have lived a long life carrying the weight of the world. It is time to set that weight down.
Try the kitchen sink hang today and tell me how it felt.
And do not forget to like, share, and subscribe.
Thank you for watching and take care of yourself.